Says it's still setting it up.
Okay. I think it actually should be live.
Okay, here we are. So welcome and thank you. Thank you for joining us. For those of you that are listening in today, thank you, Dr. Kessler, for sharing this time with us today.
Thank you, Jen.
Yes, I'm so grateful to have you here. So I really wanted to take this opportunity today to share with you Dr. Kessler, as he has been part of my healing journey. Dr. Kessler and I met about 4 years ago when I was experiencing a second health crisis, which was showing up through my thyroid. And over the years, as a health coach, I have worked with many women who have also experienced a similar experience that I had, where I was having thyroid symptoms, but my test results were showing normal, and felt very frustrated and confused with what was really happening with me. So in my personal journey, I searched out Dr. Kessler. I knew that he was practicing functional medicine and that was something that I was interested in, and was fortunate enough to be able to get in as a patient of his. And he really helped me to understand what was happening in my body when he shared with me the bigger picture through functional medicine and what was happening with my thyroid. So I feel very honored to be able to share him with you today. And I just want to start out by saying both Dr. Kessler and I have had our share of health challenges in our lives, which have brought us both to serving others through healthcare. Part of my practice now as a health coach is that I am now also a health and wellness coach through the Kadan Institute of Functional Medicine, which Dr. Kessler is the co-founder of. Dr. Kessler is also a double board certified in family medicine and integrative medicine, as well as one of the first globally certified in functional medicine doctors. He also worked in the Mayo Clinic and with the CDC, and he comes from a family of integrative health practitioners from Germany. And today we're going to really talk about, what we're bringing to you is a better understanding of this thyroid sort of epidemic that's occurring right now on the planet. There are many, many people who might be suffering from some type of thyroid dis-ease or symptoms, and many of them might not even know that they are suffering from that. And so a couple of the questions that we're going to address today, two of the big ones that I come across all of the time that we're going to discuss, really have to do with, one, why are my test results normal when I still feel symptoms? And the other question of, why are so many people misdiagnosed? And as I shared with you in the beginning, this was really how I met Dr. Kessler, through, in 2014, having my own secondary health crisis, which was related to the thyroid, when I was eating really, really healthy. And my test results showed normal, but I actually had a thyroid storm and had many extreme symptoms, and was diagnosed actually on both extremes as hypo and hyperthyroid, and then told nothing was wrong. So I was very grateful to find Dr. Kessler so that I could have a better understanding of what was happening in my body through the symptoms that I was experiencing. So that leads me into the first question that I have for you today, Dr. Kessler. What do you see is the reason why so many people, both men and women, are misdiagnosed with thyroid symptoms?
Yeah, thanks, Jen, and hi everybody out there listening. So I'm very happy to be here today to share this information with you. And for those of you listening, there are some statistics that say that according to the American Thyroid Association, in the US alone, about 20 million Americans have thyroid dysfunction, and the majority of people, I believe the statistics are something like 60%, don't even know that they have it. And for those of you listening today, you have to really pay attention. So there are some of you out there that may not even know that you have a thyroid condition, specifically hypothyroid, so underactive thyroid, or even, as we will talk about later, autoimmune thyroid. And then there are some of you where there are some indicators, either with your symptoms or with your lab tests, that may show you that there could be something going on, yet nothing is really being done about it. And then there are some of you out there that, you know, have been dealing with this for many, many years. You've been on medicine, some that have worked and some are not. So there's really this broad spectrum of people out there. And, you know, that is one of those conundrums when it comes to really diagnosing someone correctly. And, you know, one of the things when you really hear about functional medicine, one of the reasons why so many of you are not diagnosed correctly is actually a very, very important reason, is actually a very emotional reason, is that nobody really listens to you. You know, look at Jennifer. I remember, you know, when I met Jen, you know, she's been eating well, trying to do all these things, but really, not that the doctors were bad doctors she had seen, but no one really had listened really to her story as a complete story, looking at her own unique background. So think about yourself, you know, some of the symptoms you may have that could make you believe you could have thyroid dysfunction, such as fatigue, maybe dry skin, maybe, you know, some mood changes, maybe you're irritable more often, or maybe you have some gut symptoms. And then, you know, you go to your doctor, and sometimes I've seen it, you know, I've worked with over 60,000 patients, that some doctors say something like, oh, you know what, it's all in your head. Or they only do one particular test, which we'll talk about a little bit later, but this test is called TSH, which is really not technically a thyroid test to begin with. It's really comes from the pituitary gland. So to answer your question, Jen, the number one reason is really that patients are not being heard, they're not being listened to. And then if you're not really being listened to, then how do you really know what tests to order, what's really needed for the patient? So those are the two biggest reasons.
Yes, thank you. Thank you for sharing that. I think I speak for many men and women out there when I say that we all want to be heard and feel like we are being treated for who we are, not just our symptoms or the disease that we've been identified with. And that was one profound difference that I experienced myself through integrative and a functional medicine approach when I was a patient of yours. And I really can't emphasize enough how good it felt as a patient to hear that, and to be felt like I was to feel like I was being heard, and that there might be some hope in what I was experiencing. So I just want to really share that was a very profound moment for myself in just understanding what I was experiencing. And I do hear that a lot in the women that I work with, that that they want to feel like they're being heard, and they oftentimes feel frustrated with where they're at. And that is one way that the approach through functional medicine is very different. And so you answered the question why so many people are misdiagnosed. And I want to ask the question, just to dive a little bit deeper as to it, maybe we can get it into more the functional approach of this, but can you answer for me the question, why so many times the test results show up normal in traditional testing, specifically related to the thyroid, and why so many of us can still suffer from symptoms?
Sure. So I think that the key thing here is, first of all, that a lot of doctors are trained to only focus on lab tests, and they don't really take into account how a patient feels. And then when you look into lab tests, then, we all have heard about the reference ranges that, for example, a thyroid test should be in. And what a lot of you guys may not know is that a lot of these reference ranges, when they first were developed, were really based on sick people and not really on also people that may not have had fully developed, the condition to a severe level. What that means is that the reference range can really not be applied as a whole to a whole population of people at the same time. So, and then when you think about from a functional standpoint, today I want to keep this really simple. I could geek out on this really, really deeply, but that you guys really understand this is it really has to do with structure and function. So what that means is that, your thyroid is a little butterfly. Your thyroid is a little butterfly-shaped gland that sits right here in the front of your neck. And a lot of times, we also have inflammation that we deal with the thyroid. So if you only look at blood tests, for example, but you don't always look at the structure from the thyroid, then you're missing a key component. For example, that when people do ultrasounds, you take some gel and the doctor takes a picture of your thyroid, then they can determine whether or not the thyroid could be even enlarged. Could there be a growth? Or sometimes you can even tell if the thyroid is inflamed just by looking at ultrasound techniques. And then you combine that with the lab tests. And then with the lab tests, as you know, most doctors only look at what's called TSH. TSH is a fancy name. It stands for thyroid stimulating hormone. But this actually is secreted by, not the thyroid, but from the pituitary gland, which is really within your brain. And then this then acts on the thyroid to produce hormones. And those hormones is really your free T4. So, and then the free T4 then has to be converted into what's called T3. And if you don't understand some of those, what that means is very simple. Think about structure. So the T stands for tyrosine. Tyrosine is an amino acid that comes from protein. And then to this T, the 4 stands for iodine. So you have 4 iodine molecules that get added to the tyrosine that makes T4. And then in the liver and in your gut, this T4 then has to be converted to T3. And why is that so important? Because the free T3 is really your gas pedal. That's really this is what gives you energy. So if you think about all of this, if you only look at TSH and you have a reference range that may not even apply to you personally, because it's not based on your symptoms, and doctors don't even look at free T3, for example, or even free T4, then you really don't know if you really have thyroid symptoms to begin with. So this is sort of like the 30,000-foot overview. Does that make sense, Jennifer?
Yes, and I just thank you for sharing all that with us. And for those of you that are listening in, thank you for being here. And I know that maybe not all of this makes sense to all of us that are listening, but at some point in time, some of us on here may have had the experience of just that frustration of not understanding what's going on when we think we've done all the right testing. And so we do have a question, Dr. Kessler, from Linda. I'm just going to ask. I'm not sure if you can see it.
Okay.
It says, is there any connection between thyroid issues and autoimmune disease?
Yeah, of course, Linda. And thank you, by the way, for that question. Yes, right. So the most common, so how I want to answer that is that autoimmune disease is very, very common. It's actually one of the most common conditions when you think about thyroid dysfunction. And when you think about, autoimmune disease, then auto means self, and then immune means immune system. And one of the reasons why that's so important is I cannot tell you how many men and women, and sadly even children. I remember I had I think like a 6-year-old child one time, a 6-year-old boy, who had, symptoms of, for example, ADD. And when we dove deeper, he actually had signs and symptoms and lab test evidence of autoimmune disease. And so how do we know that? So this adds another layer. Think of it like an onion, right? Like you're peeling off the layers. So a lot of doctors only order TSH, and they say your TSH is normal. But what they don't order are really the antibodies. And an antibody, keep it really simple, is just one way of knowing if your immune system has been compromised. And then, when the doctor measures that, then that is one way to know if this person has an autoimmune component. And if you then combine that with the symptoms, and then you also look at the levels of your thyroid hormones, remember the T3, T4, and TSH, then you can determine whether or not someone has low thyroid autoimmune disease, we call that Hashimoto's, or if they have overt symptoms, hyperactive, that's called Graves' disease, right? So there's these two conditions, but overwhelmingly, Hashimoto's is much more common. And the problem is that, Linda, to talk to you specifically, and others are listening, right? That if you think that all this means is that, oh, I have Hashimoto's and let me just take some medicine, then your doctor has completely missed the point, because medicine alone is really not the solution to treat really the autoimmunity. Think about it like this, like, why is this really happening to begin with, right? So, and then if you look at autoimmune markers, Linda, and others, then you can have markers that are just a little bit positive, or they could be much, much higher. And then those are usually the patients that have been suffering for a long time. They haven't been heard. Nobody believes them, until one day, I had a patient that came one time, and her antibodies were in the thousands, I think, like, 15,000, something ridiculous, and then she said, oh my gosh, I'm so thankful. I can't believe that it's not in my head. It's actually true. I thought about it all these years, but no one would order those tests. So Linda, yeah, autoimmune disease, absolutely. Very, very common with thyroid.
Dr. Kessler, thank you so much for that answer. I mean, anybody who's watching can just see I have like the biggest smile on my face, because I'm so grateful for all that you're offering, that just the knowledge and the information that you're sharing. It was life-changing in my own personal experience, and I'm so grateful that you're here to share that it's possible for other people as well. The question that I want to ask, that most of us know, but sometimes we just need to hear it, that I want to share. So if we are if we're in a place where we are frustrated with our diagnosis of some type of thyroid dysfunction, or the onset of thyroid disease in either way right now, if that's where we are right now, and we're not really quite sure what to do next, I know that you shared this with me when I was your patient. You also talked about how important lifestyle and stress and a healthy diet play a role in the health and wellness, or our own health and wellness, also related to our thyroid. My question is, what would be a short-term recommendation that you would make to somebody in that position of trying to understand what's happening, feeling frustrated, knowing that we can make some lifestyle changes that might be able to keep us off medication if we're not there yet? What would be a short-term recommendation that you could share with our audience today?
Sure. I think the short-term solution is really that that you're really honest with yourself, that you really, if you haven't done it, one thing I always ask my clients, my patients when I work with them, at the Kadan Institute, is that write like a paragraph or a page of your journey of a certain symptom that you believe could be related to the thyroid. For example, like fatigue, weight gain, hair loss, dry skin, and or maybe even some gut issues. You talked about how the gut is so important for thyroid function, and really become clear, get that clarity for yourself. How long have you been really struggling with this, and how long have you not have received any answers, the ones that you deserve? That's where I would start first and get clear. Some of my patients, I'm not kidding, they've been struggling 5 years, 10 years, some of them, just a few weeks. So it's really a different spectrum. And then some of you out there, I know, have been suffering with thyroid dysfunction for a long, long time, even years. So even at that stage, you can still do something, of course, about it. And then the next step, the short-term solution, is really that you get adequately and properly diagnosed. And for that reason, either you find a good physician who has the time it takes to listen to you and to also order certain tests, who is willing to partner with you. It's not always easy. I used to do traditional primary care, and when you see about 40 or 50 patients a day, you're lucky if you get 5 minutes. So how is that possible, right, to really do all that? So you really want to partner with a physician who can do that for you. And then to really find out, like Linda asked, even if my TSH is normal, my T3 is supposedly normal based on the reference range, could I have autoimmune dysfunction, for example? And then once you actually know that, then the next step, the short-term solution, is that you commit, that you want to do something about it. Because if you don't, if you do the same thing over and over, you get what you have always done. But if you say, you know what, no more, today is the day, I'm committed. I have this clarity now. That there are people, like us at Kadan Institute, like Jen, who has gone through her struggles. We are, one way of looking at it is, we are just like you. We've had our own health struggles. Jen with her thyroid, me with my gut issues over the years. That's another topic for another day. But extraordinary to the point of you have to work with an expert who knows, who has practiced for many years, who has done these tests, who knows how to interpret them. And there are plenty of functional medicine practitioners out there. Just make sure that you have someone who's certified to do that. Once you've committed to that, that's the short-term solution. Then you can plan ahead and say, okay, what is my long-term solution? What is really the outcome that I'm after? Do I want more energy? Do I want my thyroid to be normalized? Do I want my antibodies to go down? I mean, it's really beyond that for a lot of people. It's really not just about tests. It's really about your life, how can you function better professionally, and how can you function better personally? Fatigue, for example, takes a huge hit or impacts people in a lot of places. That's probably where I would start. We all know that lifestyle is important, and that is why it's so important that we have Jen on our team, and other clinics, they also have coaches on their teams, because you need someone who knows that they've been there, they can go that journey with you, but then also help you with the accountability, so that you have to have that team on your side. It's like a boxer in a ring, right? So who do you have in your corner? If you're just alone out there, you don't know what you're doing, really. And it's much, much harder. That's what I would tell you.
Perfect. Thank you so much. I'm just going to invite everyone who is on here right now listening, that as we're wrapping up, if you have any more questions that you'd like to ask while we have this time with Dr. Kessler, that you please type them in the comments. In addition, you can still continue to write comments afterwards if you're watching this replay afterwards, and I'll do my best to be on here to answer any questions that I can. But if you're on here live right now and you have any questions, please feel free to ask them. What I heard you say, Dr. Kessler, is that the first step short term is to get really clear on what it is that you're actually experiencing. And I remember doing this as your patient 4 years ago. I wrote my paragraph and got really clear and really present with myself. Like, what am I actually experiencing? And what is it that I actually want? And so next step I heard you say is to get the support that you need. Like, think about what it is that you desire in your life. Because for me, this was lifestyle. For many of us, it is about the lifestyle. I wanted to be a better mom and better wife, and in the way that I wasn't so tired and irritable all the time. And I was so grateful that I've learned that, for me, like, feeling healthy in my body allows me to show up as the best version of myself. And I know that many of the women I've worked with can say the same thing. So getting really clear on what it is that you're experiencing, what it is that you want, and getting the support that you need. And I don't see any other questions coming up. So before I close, and I'll invite you, Dr. Kessler, to close with any remarks that you have. I just want to thank you for those of you that did join us today. We do have the intention of presenting other topics in the future. So if you know that there's something that you would like to ask a question about, please send me a personal message or an email. My website is jennifermccarthymons.com, but then also as a health and wellness coach at Kadan Institute, you can send an email to jen@kadaninstitute.com. And I do invite you to check out kadaninstitute.com. That's Kadan as in Kadan institute.com, just to see what it is, the services that we're providing, so that you can just start to see, maybe you're new to functional medicine, maybe you're new to the idea of any holistic or integrative approach to medicine. But I just really, if there's any takeaway from this call today, I really invite you to step outside the box, believe that there is someone out there who is willing to support you, and start doing some of your own research, maybe locally, or we provide services to clients, not just in Florida. So you can check us out on the website and start thinking about what it is that you're experiencing and what it is that you want and changes that you might be willing to make, and just start exploring other options out there. And so I invite you to check out our website, post any questions that you have. I do have one more question coming in, Dr. Kessler, if you don't mind just staying on to answer this question.
Sure.
What are your thoughts on naturally desiccated medications?
Sure. So before I answer that question, so our goal here is that we will actually have various topics, and we're not really done with the thyroid. There will be future Facebook Lives, on the thyroid. It's not something you can tackle, in 15 minutes. So I know that, questions like medicines or, other, testing questions, what nutrients that are involved in thyroid. I mean, there's so many topics that we can talk about to really give you that overview. But so I'm going to answer that question about the natural desiccated medicine. I want to end it with a story of a patient of mine. And so this lady, she came in with fatigue, weight gain, hair loss, for about 10 years. And she was fortunate enough that she was diagnosed with hypothyroid. So she did have TSH done, she did have her T4 done, T3 done, but she never had the antibodies done. So when I asked her, do you have only quote unquote hypothyroid, or do you actually have Hashimoto's? She did not know what that meant. So when we then tested her antibodies, she did indeed have evidence of autoimmune disease. And then when I really dug deeper over the years, she had been on various medicines, anywhere from, levothyroxine, so Synthroid, which is really the T4 we talked about. So you're actually giving T4. And then she heard from a friend that maybe I should try Armor Thyroid. This is something we'll go on further and further future, Facebook Lives, but Armor is a combination of T4, T3. And that helped for a little bit, but then, her energy really never got better, despite, the doctor just increasing the dosages. And then when I looked at the antibodies, I asked her, when, you've been dealing with this now for about 10 years, what do you think really was the first symptom of your fatigue? And then when we dug deeper, she actually told me that about 5 years prior to the 10 years, so really 15 years back, she struggled a lot with actually gut issues like irritable bowel syndrome, indigestion. She actually had some food poisoning, and she actually went on a cruise to Mexico way back when. And when I asked her, did you get sick on the cruise? She said, actually I did. And come to think of it, I was never the same since then. And listen to that, right? So she said, I was never the same since then. For 15 years, she has never been the same. So as a doctor, when we measure autoimmune markers, so auto means self and immune means immune system. If you're not yourself, really, doctors really, missed it, to really look into autoimmune, way, way back when. Happens all the time. And then once we actually discovered, that I asked her, do you still suffer from gut issues? She said yes. Once we actually addressed it, she had some food issues from food sensitivities. She had some infections. She had overgrowth of some bacteria. And on top of that, we then switched over to some natural medicines. We actually compounded it. The reason for that was so important because some of the medicines actually contain fillers, such as gluten, believe it or not. And for those of you that don't know, gluten is a huge bully for the thyroid. And here she was taking medicine that she thought was actually going to help her, but not that the medicine was necessarily bad, but the fillers were actually bad for her. So, but it took time to discover that. Once we did that, that also helped her. So the idea here is that there are all kinds of different medicines, but in the end, you want to think about, why is your immune system under fire? And a lot of times this happened years ago. That is why your short-term solution today, your call of action is, the emotional component of this is, be honest to yourself and say, how long have I really been suffering? Because the idea with a paragraph is we do a timeline and we say, when did this symptom first start? What was going on around that time in my life? And usually, from my experience, a stressful event happened. It can be something as simple as food poisoning, maybe parents got divorced, maybe you guys, somebody died, God forbid, or you were just in a bad place, or, you just powered through a very stressful time in your life and all of a sudden you're getting more tired. You see how complex it is, but that's why the short-term solution is, I need to know your story. And Jen needs to know your story. And once we know that, then we know what tests do you actually need to get you where you want to be. So that is really a brief overview, 30,000 view overview of functional medicine. That's why we call it Kadan Institute Unique Medicine, unique to you. So, so share some frustrations with us, share some hopes with us. Share this with anybody that you can think could benefit from our Facebook Live, series. Like I said, there's people of you out there that have symptoms you don't even know you have thyroid issues. Those of you that maybe have what's called subclinical thyroid, or those of you that have been suffering for a long time, even if you have, there's always hope that you can do something about it. So thank you so much for having me here today. And thanks so much for you guys listening out there. It's been a pleasure.
Thank you so much, Dr. Kessler. And I'm getting a lot of comments as we're wrapping up, and just really being able to identify with the story that you shared. And so what I haven't mentioned yet that I'd like to say is that we invite you to come to kadaninstitute.com and just fill out the free health assessment. Fill out the free health assessment and really take the time to connect with what your story is. Identify what your symptoms and your story is, if nothing else for yourself, so that you've taken that time to really understand where it is that you are and where you want to go. And you can do that on our website at kadaninstitute.com. And I will also
Right.
I'll put that link in the comments in case anybody misses the spelling. It's Kadan. And Dr. Kessler, thank you so much for your time today. I know that you're a very busy person, and we're just so grateful for you connecting with us today. And we look forward to hosting another one. We'll see what questions come in and what people really want to hear about. And I just want to say thank you so much. And thank you to all who are listening.
That sounds good. Thanks, Jen. Thank you so much, everybody. And see you guys soon, very, very soon.
Sounds great.
Have a good day.
Thank you. You too. Bye.
Bye-bye.